a good one. And this one applies to everyone. Are you going to die from trying to understand health insurance? Ronnie Elder is here. She is one of the extraordinaire over health insurance and how it works. And it's truly like a passion of yours, right? Mm-hmm. Tell us a little bit about that.
So I've been in the industry for 19 years now. I did an apprenticeship with an urgent care facility when I was 20.
Wow.
It took me a year, but I've been working in this sector of the medical field ever since.
And so you truly do not only understand health insurance, but then you actually help explain it to our patients, and so they can feel better about, you know, what's being taken care of, right?
I do.
That's incredible, because I don't think many companies even offer that.
I don't know.
Kind of like a you're on your own type of thing.
Yeah, I think whenever you walk into most medical facilities, they don't. There's a gap between the personable part of medical care,
right?
And that's where people like me step in.
That's amazing. So EOBs, right?
Mm-hmm. Explanation of benefits. Yes.
Explanation of benefits.
Yes.
So you're going to tell us a little bit about how insurance works. Mm-hmm. Tell us, like, let's start at like 101, right? So 101 is probably like, what is a deductible?
Well, a deductible is an out-of-pocket amount. You know, whenever a patient decides to go with a medical insurance policy, it's a lot like in car insurance or maybe a mortgage or something like that, where you go to an entity that's going to offer you that policy. They give you several different options of a monthly premium amount that you would pay. And based upon the premium amount that you would pay each month for the policy is how much you would pay out of pocket.
And so some people decide to pay or choose the health insurance that is the cheapest per month, right?
They do. A lot of people try to go based upon what they can budget, and they don't understand that when you enter into an agreement with the insurance company paying a premium per month, you're actually entering into a contract with them. So based upon that contract, you have an out-of-pocket amount that you would have to meet every year, and it usually rolls over each year with the new year, that you will have to pay.
It rolls over.
Yeah, you will have to pay in addition to the premium that you pay every month. So going with the cheapest route's not necessarily the best option.
Wow. Okay, so I hope we've already offered you one really big piece, because I just learned something new. But let's dive into like the myths and the facts. And then, of course, if you have a question for us or for Ronnie, which I think you might be like slammed after this segment airs, but of course you can message us or comment and ask us questions, and we can certainly help you, because I think healthcare big picture is all about helping people. So myth or fact, health insurance is all about profits for the healthcare companies. Like,
that's a myth. Because health insurance, it comes with a cost. Health insurance is expensive because health care is expensive.
That's right.
So there's tons, millions, billions of dollars that go into developing a lot of the different testing and labs and X-rays and CTs and MRIs, and all of these things require money to not only create, but to test and to study and to perform. And so that costs money, therefore the policies are going to cost money as well.
So that's what your health insurance goes towards.
Mm-hmm.
That's a big one. So a myth or fact, a young and a healthy person does not need insurance.
That is a hard myth.
Come on, but it's cheaper. I'm good, I'm healthy, I don't need health insurance.
I've heard a lot of people say that, I haven't been to the doctor in 5 years. That doesn't mean that tomorrow you won't get into a car accident and break a bone. It's always better and more cost effective to be proactive at a younger age with your health care, getting regular physicals, making sure that you get all of your vaccinations and things like that every year, than being reactive at the later stages of life. Because that's where your grandkids, that's where the money that you were going to leave for them is going to go. So
there you go. Well, let's do this. A myth or fact about insurance coverage means anything is covered.
That is a myth. That is one thing most people.
Really?
Yes.
So if I get health insurance, I'm not like an umbrella of everything is covered.
No. No, not at all. So even just because you pay your premium every month does not mean that policy that you're paying for covers everything that the doctors are going to want to do. So you have in and out of networks that you've got your contracted doctors that you can go to, that you can have regular checkups and everything performed, and that's just basic care that you would need to do. And then you have other more in-depth testing that maybe for cancer and maybe for like radiation and things like that may not be covered.
That's a different level of
That's
coverage?
a whole different level. Yeah, it's a different level of coverage. If you have the basic of all policies, basically what you're doing is you are getting help with getting your office visits paid for when you get your physicals done.
So when you go to, because it's kind of the time of year, is there one time of year for coverage and choosing benefits?
Yes.
Yeah.
Right now would be that time because most people have met their deductibles, co-insurances, and co-pays. Their max out-of-pockets have been met for the year. So there would be, once your max out-of-pocket is met for the year, that means no co-pay would be required and no deductible or co-insurance would be required. So you would be fully covered at 100%.
For all types of visits?
It depends upon your policy. You would have to check with your policy to make sure.
You and I were talking, and we were saying, what were we saying in the very beginning about there's different health insurance companies, right?
There is.
But overall, isn't it all the same?
No, you've got.
Oh,
I mean,
you just dispelled a myth.
I just dispelled it.
fact.
Yeah, it does. It is all of the same, but it depends. Your policy and what you can pay for is going to dictate what type of coverage you have.
But if I have like there's big named health insurers, right? So are they all the same? Or should I shop around, or can I shop around?
You can definitely shop around, most definitely. You want to make sure that what your budget is every single month. You don't want to just look at it from a monthly standpoint. You want to look at it from a yearly standpoint. So if you go with Blue Cross Blue Shield, they're a little bit more expensive, but they have a lower deductible rate or a lower out-of-pocket max amount per year. That would be the one that you would want to go for, because that means that the higher cost testing and things like that would be covered and be less out of pocket for you.
That's very valuable. So hopefully you've understood all that, or you can message us.
Yeah.
Yeah. I think insurance is just it's a beast, right?
Kind of, yeah.
But you understand it, so
I do.
it's not for you. So how about that? Insured people get better service than the uninsured people.
That is a myth.
Healthcare.
I'm sorry. That I feel kind of passionately about this one because in my background, I have worked in urgent care facilities where we have we always had a single rule that a patient is a human.
Absolutely.
Bottom line, these are daughters, these are sons, these are grandparents, these are parents, these are people. They're not just a number. And I think that ENT, we wholeheartedly go with that as well. Insured might mean quantity, but it's going to be less about coverage and more about region.
Really?
Yeah. So if you've got, let's say you're living in the mountains or something like that, most of the clinics up there understand and realize that most people can't afford a monthly premium. They can't afford insurance. So what they'll do is they'll offer a reduced self-pay rate so that it will assist the patient in taking care of their care.
So could people, if they have insurance, could they still ask for a self-pay rate?
They certainly can. You can always pay for your visit as a self-pay and get that reduced rate, and then turn around and file the claim yourself. Oh. That's always an option, yes.
Just a little more paperwork in the back end?
It is. It helps you. It helps the patient themselves kind of control the claim process and getting all of that done. I don't advise it. It's a lot of information. it's a lot of work.
Take it from an expert. Easier not to do that.
Yeah.
So how about as long as someone's on their parents' plans, they're covered? Oh, this is a big one.
That's a big myth. Just because you live in your parents' home and your parents have insurance does not mean that you are going to be covered past the age of 26.
26 is an astounding age for me because when I was growing up, it wasn't 26. So
it was 18.
Yeah.
Yeah.
So what changed?
The Affordable Care Act changed that. So what their vision was, for the Affordable Care Act was that if kids are living in their parents' home and going to college,
Right.
that, you know, they would be just starting out, that they would still need that coverage. And so that's kind of the brainchild for it.
Got it.
Well, fortunately for a lot of people, as long as your parents and you're under 26 have a family plan, and you're listed as and you're listed as a patient that would require that as a dependent, then you would be covered. But just because your parents have insurance and you live in the home and you're less than 26 does not mean that you would automatically be covered.
Do you get a lot of questions about that?
I do.
Yeah.
I do.
I just learned something new.
Yeah.
So you have to be on the family plan, and you're covered up until 26 as long as you live
Yes.
in your home, or is that like your primary residence?
That would need to be your primary residence. The only way that you would be able to remain on your parents' plan over the age of 26 is if you were classified as fully medically disabled. So, and then you would get Medicare and Medicaid, and that's a whole nother beast.
Yes, it is. So, what else do you want to tell us about insurance? Because we're trying to keep it pretty high level today, because I mean, I know you and I could talk about this for days, right?
Yeah.
What else, anything else that you think people should know? Are there changes coming up?
Yes. So every year, there is always the new year. A lot of people don't understand what a year premium is. Year-to-date premium and versus what a plan premium.
Oh.
So.
Okay.
A year-to-date plan it transitions every year, so it starts over every year.
That's what I thought every insurance was.
Right. So every year, whenever you've paid your deductible, like this is the prime time for you to get some sort of something done.
Right.
Most people, this is the time of year that they pick to do surgeries, and they pick to do like those higher end, higher cost medical treatments. But as of January 1. Probably about 97.8% of policies are then going to start over, meaning the deductible and everything is going to reset, and you now have to meet all of that out-of-pocket max all over again.
Got it.
And then you've got some plans that are a plan year.
Okay.
So when you signed up, say if you signed up January 1 or July 1 of 2019, it wouldn't roll over until July 1 of 2020.
Right.
And so that's where the gap kind of happens.
Okay.
Yeah. And then, as far as like deductibles, co-payments, in and out of network and all of that stuff, always check with your policy and always check with your insurance company. And the biggest question is, what am I going to have to pay out of my pocket?
That's the question.
Biggest question.
What are you going to have to pay out of your pocket? So they can call their insurance company and they can ask that point blank question.
Yes.
Okay. So if you've taken anything from this segment with Ronnie, and she's the expert, that's the $1 million question.
It's the $1 million question, and they have customer service reps that are that are fully ready to answer any questions you have in regards to your policy.
That's awesome to know. So are you going to trying to understand your insurance? No. We don't want anybody to die trying to understand their insurance, but being an educated person about your insurance, being armed with the right information, I think is the key here. So we're always happy to help, especially our patients, because we have talent like Ronnie herself, who really does take the time to work with each individualized person and patient and make sure that they're getting, because not only the treatments that they need at our locations, but the insurance coverage and benefits, and understand what ultimately is going to be your out-of-pocket, like what's going to come out of your pocket in and above what you already pay for health insurance.
Yes.
That's the big doozy right there.
And what people pay, the out-of-pocket max is always set by the policy that you pay for. So that's where we were saying, if you choose the cheapest premium, that the monthly payment that you make, that might mean that your out-of-pocket amount that's set by the insurance for that policy that you're paying for might be extremely high.
Right. So either way, you have to pay for the medical care that you're receiving, and know that hopefully where you choose to have your care done is really going to give you the best quality level of care for your health care through insurance or through your own pocketbook.
Yep.
So thank you for joining us today. Thank you for being
Yes,
here.
thank you for having me.
We hope that you found this really valuable. And as always, message us, send us an idea for a new show. I think we've got some new looks and feels coming around our Am I Going to Die show, and I'm really excited. I'm always thrilled to bring you quality content and something you can learn from. So have a great day, and make sure that now you're armed with some more knowledge around your health insurance coverage.